Good afternoon, I'm Rebecca Hearn. I'm going to teach my daughters Alexis and Blair about hypoglycemia, the serious complications for the older adult with diabetes. We're going to talk today about Mr. J is an 86-year-old man who has type 2 diabetes for the last 15 years. His hemoglobin A1C is around 7 to 7.5, and a hemoglobin A1C is the amount of glucose that you have in your system within a 3-month period. Mr. J's wife recently died, and he's now making his own meals at home. And he was found to have lost 8 pounds the last time that he went to the doctor's office. He doesn't have any help at home. His daughter came by to see him and found him confused and diaphoretic, so that means like sweating really bad. She called 911, and emergency medical technicians arrived and tested his blood glucose level, and they found out that it was 53. He was brought to the emergency room for care. Does anybody know what hypoglycemia is? Lexi, do you know what hypoglycemia is?
Yes, I do.
Okay, what is it?
Low blood sugar.
Do you know a number for the blood sugar?
25.
25. All right, that's a good guess. Blair, do you know what hypoglycemia is? What is it?
When you have low blood sugar.
Low blood sugar, that's right. Everybody knows that. That's great. What number would you guess that it is?
57.
57. That's a good guess. So, low blood sugar in the first stages are usually 70 or below. 70 to 55 is the first stages. And I'm going to give you this. This is the Diabetic Research Institute low blood sugar hypoglycemia. And this tells about the first stages or symptoms are usually around 55 to 70. And the signs that you'll have are sweating, shaking, weakness, feeling tired, anxiety, fast heartbeat, tingling of the lips. Your second stages, your symptoms may include, and the second signs and symptoms are less than 55 blood sugar. Irritability, confusion, inability to think clearly, drowsiness. If it's very, very low, much lower than 55, you might have a risk of unconsciousness. So Mr. J could have been unconscious. Let me tell you some more things about him or older people in general with hypoglycemia. They are particularly, can lead to a number of complications, including falls, unconsciousness, seizures, cardiac events, and even death can happen if their blood sugar gets too low. And a lot of times people might think they're drunk because their mental capacity is kind of slowed and they act kind of drunk. But what it is sometimes their blood sugar is just too low, and that's how they act. Symptoms usually start when the glucose drops below 70. They'll have vision changes that may affect their ability to prepare meals, check their blood glucose, or prepare and administrate medications. So a lot of times older people, they don't have good vision in the first place, and so it's hard for them to prepare their medications, draw up their insulin, to prepare their meals and things like that. It's hard for them to do that. They can have change in their motor function or manual dexterity, and may interfere with meals and medication preparation of the blood glucose monitoring. So these are things that happen as you age. Again, signs and symptoms of hypoglycemia may be intense hunger, shakiness, nervousness, sweats, chills, clamminess, difficulty speaking, confusion, things like that, headache, can't sleep. And does anybody know what the treatment for if your blood sugar is below 70 and you get that shakiness and that clamminess? Do you know what any treatments are?
Some sugar.
Some sugar, good. Do you know how much sugar you're supposed to have, Blair?
Probably a lot.
A lot. Well, what is something that if somebody had hypoglycemia, you would think that they would need? Like what kind of sugar? Would you get chocolate?
I'd get like some Starburst.
Starburst, that's right. Starburst would be a good one. The rule of 15 is what we go by. And if you look at the top part of this paper in the box, it says if you have a blood sugar less than 70, 15 grams of quick-acting carbs, like glucose tablets. Have y'all seen those before? They're the little tablets that come in like, it looks like a thing that the miniature M&Ms come in, except it's glucose. And sometimes they're cherry or grape or strawberry. You can use juice, 4 ounces of juice, regular soda, or just candy, like Starburst. Starburst is a good idea. Then what you'll do after you get that 15 grams is you recheck the blood sugar in 15 minutes. What that does is that gives the blood sugar time to come up. And then you'll repeat if the blood sugar hasn't come up, say it's 70, still 70. Repeat the 15 grams of quick-acting carbs until the blood sugar is above 70. So that means the rule of 15 is less than 70, you give 15 grams of carbs, recheck in 15 minutes, give 15 grams of carbs, and you just do that until you can get their blood sugar back up. That's one thing that's easy for you girls to do because you have access to things like that, sodas and candy. Other things like the glucose tablets, you might not have access to that, but that's okay. We have other alternatives. Also, on this Diabetes Research Institute papers that we have, it also tells about some treatments, and it tells us what 15 grams of carbohydrates include. That's the 4 ounces of juice, 6 ounces of regular soda, soft, pure candy that is easy to chew, sweet tarts, or guess what, Blair? Starburst. So that was a great thing. Things that are not good to have are chocolates, because they're high in carbohydrates, fats, and they only bring the glucose up slowly, not quite quickly enough. Do you know what any causes of low glucose might be?
Not eating.
Not eating. That's good. Blair, what about you? Do you know any reasons why your sugar would get really super low? Other than not eating.
I was gonna say something that I really didn't think of a lot.
Well, tell me.
Like we just like lay there and don't do anything.
Well, maybe.
Not
Not taking your diabetes medicine. Or taking too much of your diabetes medicine. Not taking in enough food, like you said. Too much exercise and alcohol. Everybody knows that alcohol is bad. Things that you want to teach your patients or your people, your older people, are that you need to learn your body's warning signs about if you have low blood sugar. Always carry a fast-acting glucose. Remember the rule of 15s with that. Always carry some candy or something like that in your purse or your pocket or in your car. Wear some form of diabetic identification. So a little bracelet or something in your wallet that says that you're diabetic, so that people will be aware and won't think, they'll kind of have a better plan of action of how to help take care of you. Check your blood glucose levels before you drive. That's very, very important, because remember we said that you could have some confusion and you might, not be able to drive, or if you were driving and your blood sugar drops too low, what might happen? Might have a car accident. That would be terrible. Explain the possible signs and symptoms of treatment of blood glucose levels to relatives, friends, or workmates. That's what I'm doing for you guys. You're my relatives, and I'm teaching you about low blood glucose. And your Nana has a form of diabetes where her blood sugar runs a little too high normally, but she doesn't take medicine that gets it too low. But if she were ever run too low, you would know what to do. Don't go to bed with the blood glucose level below 100. Good bedtime snacks. What do you think a good snack before bed would be? To keep your sugar up. You don't want to run it up too high, so you don't want Starburst.
Yeah, some Oreos.
Sorta. Good bedtime snacks include 8 ounces of milk, or 3 crackers and half a teaspoon of peanut butter, or 3 crackers and cheese. That's always good, isn't it? Everybody likes crackers and cheese before you go to bed. So let me tell you some more about hypoglycemia awareness. With age, certain nervous system responses of hypoglycemia, including the release of stress hormones like epinephrine, cause warning symptoms such as rapid heartbeat, and those may not be seen. When this occurs, the person may not have any physical symptoms to indicate that the blood glucose is low, or may be less likely to notice the symptoms. So you really have to pay attention to older people if they start feeling bad or things like that. Sometimes they don't even have any symptoms. They might just pass out. And then, that's kind of scary too. Okay, so let's go through and see if y'all know. We're going to ask a couple of questions and see if I have done good teaching for you guys today. So tell me, Lexi, what is hypoglycemia?
Hypoglycemia is low blood sugar.
Okay, great. Blair, what is our number? What's our number that we want to be if we're lower than what? 70, that's right. Okay, Lexi, give me 2 signs and symptoms that your blood glucose might be below 70.
I say anxiety and sweating.
Anxiety and sweating. Blair, can you give me 2?
When you're shaky.
When you're shaky, that's right. One more.
When you have a really fast heart rate.
Very fast heart rate. That's great. What are some causes of things that might cause you to have low blood sugar, Lexi?
Oh, alcohol.
Alcohol.
When you work out way too much.
When you exercise too much. That's right. What is one thing that you can eat or do to raise your blood glucose if you're having a low glucose level?
Sugar.
Sugar, like
Sugar
what?
like soda.
Like soda. What about you, Blair?
Starburst.
Starburst. That's right. Starburst would be great. And everybody should know this. This is a very, very important part of knowing what to do in the case of an emergency. What do?
You call 911.
Call 911. That's fantastic. All right, good. Y'all done a great job today. So I'm going to show you a copy of what the Diabetes Research Institute low blood sugar and hypoglycemia look like. And this tells about the rule of 15. These are the first stages and the second stages. And also on here, it tells the treatment and the causes. And my girls have done a great, fantastic job, and I'm so proud of them. And this is the conclusion of our video. Thank you.